vertebrae and upper limbs. This is a general picture of a vertebrae. There are some parts and pieces of a vertebrae that you need to know. First, you have the body. This here is the body of the vertebrae. The vertebral arch is made of two parts. This would be the vertebral arch. The legs of the arch are called the pedicles. Pedicle would be here and here. And the top of the arch is the laminae, which would be here and here. The vertebral foramen is here in the center. The spinous process is the part that sticks out here. This is the part of the vertebrae that you can see going down your back, all those little bumps. That would be the spinous process. And the transverse process are the wings to the side. Transverse process, transverse process. When the vertebrae come together, they create holes here, here, and here, which are the intervertebral foramen. This is space for the main nerves coming off the spinal cord to come out and go to the body. There are 5 sections of vertebrae. The first section up towards the head is the cervical. The cervical are here. In humans, we have 7 cervical vertebrae. So we would know that as C7. We can tell a cervical vertebrae as they are smaller than the other vertebrae. They have these 2 smaller holes. They're called the transverse foramen here. And then many of their spinous processes are forked. Some of them are more forked than others as you kind of go down towards the bottom. So like C6 and C7 have less of a fork on their spine than 2, 3, and 4. C1 and C2 have special names. C1 is called the Atlas. The Atlas is named after that Greek god that carried the earth above his head. The atlas is the first vertebrae. It's the one that articulates with the skull. It'll articulate with the occipital condyles right underneath. And this holds your head up. So atlas is C1. C2 is the axis. The axis has a special process called the dens here that allows for the axis to rotate. So it will rotate on that dens. The next section of vertebrae are the thoracic vertebrae. This is going to be attaching to your ribs. In humans, we have 12 thoracic vertebrae. You can tell thoracic vertebrae as they have a smaller body and a fairly long spinous process. The next section is the lumbar vertebrae. The lumbar vertebrae are here. We have 5. The lumbar vertebrae you can tell because they have a very large body. And then they have these extra little sticky outies here, and the spinous process is short. So the lumbar vertebrae have a shorter spinous process and then have a couple extras on the side here. This makes up your lower back. Then we have the sacrum. In humans, these are fused. So we have 5 sacral vertebrae, but these 5 sacral vertebrae are fused together to make one. Not all species have a fused sacrum. There are some species that will have individual vertebrae at this point. The sacrum is here, and this is connection towards the hips. Looking at the sacrum, there's a couple parts and pieces we need to know. We have the sacral foramen. These are the small holes here. The sacral canal. The sacral canal is the hole going down this way, where the tail end of the spinal cord goes. The sacral hiatus would be the opening to the sacral canal down this way. And then the last part of the spinal column is the coccyx. The coccyx we abbreviate as CA. Again, in humans it's fused, but in other organisms it is not. In humans we have 4. The coccyx is here. This is known as the tailbone. Here is a chart comparing different species. We have the human, the dog, the horse, and the pig. If you notice, all species have 7 cervical vertebrae, and that is true across all vertebrates. All vertebrates have 7 cervical vertebrae, and then differing numbers for each of the other categories. One way to help you remember the order of sections of vertebrae, as well as how many there are in each sections for humans, is this little saying: come to lovely Southern California on flight 712554. We have cervical, thoracic, lumbar, sacral, and caudal, or the coccyx, on flight 712554 because we have 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 caudal or coccyx. Looking at the thoracic cage consists of ribs, the thoracic vertebrae, the sternum, as well as costal cartilage. Costal cartilage is the cartilage that attaches the ribs to the sternum. Looking at the ribs, humans have 12 sets. That makes 24 total. And males and females have the exact same number. There is no difference between male and female. The first 7 ribs are called the vertebral sternal because they are directly attached to the sternum with the cartilage. These are also known as the true ribs. The next 5 are false ribs. Of those first 5, the first 3 of the false ribs are called vertebrochondral ribs. That is because they go from the vertebrae to the cartilage of the last true rib. So the false ribs, or the vertebrochondral ribs, the cartilage attaches from the rib to the last vertebral sternal rib. The last 2 false ribs are floating. They don't attach to the ribs in the front at all. They're only attached to the vertebrae in the back. The sternum has 3 parts. We have the manubrium. The manubrium is the top portion. We have the body, which is the middle portion here. And then the last part is the xiphoid process. The pectoral girdle is made out of the scapula and the clavicle. You have 2 clavicle and 2 scapula, one on each side. The clavicle is also known as the collarbone. Most species actually do not have clavicle. Cats do have a remnant of a clavicle. They have a very small, unusable clavicle. Dogs, horses, cows do not have clavicles. The scapula is located on the back. This creates the point of your shoulder. There are some parts of the scapula that we need to know. We have the spine of the scapula. This would be sticking out away from the body. The spine is here. The acromion is attached to the spine. It is this large process here, or this process here, or this process here, depending on which way you're looking. The other sticky outie is the coracoid. The coracoid is attached to the glenoid cavity, which we will talk about in a second. So here, here, and here would be the coracoid. We have the glenoid cavity. This is where the humerus attaches and articulates. Glenoid cavity there, here, and here. So the acromion is attached to the spine. The coracoid is attached to the glenoid cavity. There are 3 fossa that we need to know. This is where muscle is going to lie within the scapula. We have the subscapular fossa. This is going to be between the scapula and the rest of the body. It is going to be found on this surface. There is a muscle that lies here, so that it would lie between the scapula and the body. This is the underneath side of the scapula, away from the spine. Supraspinous, supra means above, so it's going to be above the spine. That would be here. It is a smaller fossa. Again, there's going to be muscle lying here. Infraspinous fossa, so infra means below. It is here, so it is below the spine of the scapula. Now looking at the upper limb, we've got the humerus, radius, ulna, carpals, metacarpals, and phalanges. The humerus is the upper arm. This articulates with the scapula and the clavicle. The head of the humerus is here. There are 2 necks on the humerus. The anatomical neck is the true neck. The neck is where the head meets the bone. That would be here. The surgical neck is where it's often broken and needs surgery to fix, which would be here. The deltoid tuberosity is where the deltoid muscle, the shoulder muscle, attaches on the humerus, which would be this bump here. The radius is the lower arm, and when you have your lower arm, if you have thumbs up, the radius is on the top, the ulna is on the bottom. So thumbs up, radius on top, ulna on bottom. It's in alphabetical order. This bone here is the radius. Head of the radius is a disc, which allows for rolling across the ulna, and it allows you to do this. The radial tuberosity is here. Again, that's muscle attachment. The ulna, again, thumbs up, ulna is going to be on the bottom. The ulna is this bone here. Also, I like to think that the ulna tells you what bone it is because it has a U right there telling you it's the ulna. The trochlear notch is that U that is being formed. So the trochlear notch is here. On this picture, it would be here. The olecranon is the point of the elbow, which would be the top portion here. That's the olecranon. And the coronoid process is the bottom portion of that notch. That would be here. That's the coronoid process. The carpus is a bunch of short bones coming together. The carpus is made up of carpal bones, so carpal bones are located within the carpus. If we take a look here, we have our thumb here and our pinky here. There are 2 rows of bones with 4 each. The first, if we start on the thumb side, closest to the radius and ulna, we have the scaphoid, lunate, triquetrum, pisiform. Then going back to the thumb, closest to that thumb bone, we have the trapezium, trapezoid, capitate, hamate. There is a little saying to help you remember this. Scaphoid would be she. Lunate, looks. Triquetrum, 2. Pisiform, pretty. Back to the thumb. Trapezium is under the thumb. This would be tri. Trapezoid, 2. Capitate, catch. Hamate, her. She looks too pretty. Try to catch her. Starting here, she looks too pretty. Back to the thumb. Try to catch her. Scaphoid, lunate, triquetrum, pisiform, trapezium under the thumb, trapezoid, capitate, hamate. The palm of your hand is made up of metacarpals. They are numbered 1 through 5. Your thumb being number 1, then 2, 3, 4, and 5. Then you have your phalanges. The phalanges are the finger bones. In your thumb, you only have 2. In your fingers, you have 3. The one closest to the metacarpals is the proximal phalange. The ones furthest away are the distal phalanges. The ones in the middle on your fingers are the middle phalange. Your thumb does not have a middle phalange. On carnivores, the first digit is often called the dew claw. Not all carnivores will have a dew claw, but if they do have it, it's generally up further the arm, and it's a little kind of dangly digit. It's called a dew claw. When you are declawing a cat, what you are taking off is the entire distal phalange. So you'd be removing this entire portion. Sometimes it's done with a scalpel, as seen here in the picture. Sometimes it's done with nail clippers, the kind of ones that you would use on nail clipping a dog. You can use that. Now they're starting to use laser to help kind of burn that area. So when you're declawing a cat, you're taking off the entire top phalange, that distal phalange. So you're not just removing the claw, you're actually removing bone as well.